We hear the word narcissist thrown around a lot these days, don't we? It's become a casual label for anyone who seems a bit self-absorbed, vain, or overly confident. But what if I told you that this popular understanding barely scratches the surface of a complex and often devastating mental health condition? What if the person you're labeling as a narcissist might actually be suffering from something far more profound, and the people around them are suffering even more? For those who have truly experienced narcissistic abuse, the reality is anything but casual. It's a world of confusion, self-doubt, and profound emotional pain. Victims often feel like they're losing their minds, constantly questioning their own perceptions and sanity. They grapple with the agonizing question, what exactly am I dealing with? This isn't just about someone being a little selfish, it's about a pervasive pattern of behavior that can systematically dismantle a person's sense of self and reality. Understanding this distinction is not just academic, it's the first crucial step towards healing and reclaiming your life. So let's move beyond the armchair psychology and delve into the clinical reality. Narcissistic personality disorder, or NPD, is a diagnosable mental health condition recognized by the American Psychiatric Association in their Diagnostic and Statistical Manual of Mental Disorders, 5th edition text revision. It's not just a personality trait, it's a pervasive pattern of grandiosity, a constant need for admiration, and a profound lack of empathy, beginning by early adulthood and present across various contexts. To be diagnosed with NPD, an individual must exhibit at least 5 of 9 specific criteria. These include 1. A grandiose sense of self-importance. They exaggerate achievements and talents, expecting to be recognized as superior without commensurate accomplishments. 2. A preoccupation with fantasies of unlimited success, power, brilliance, beauty, or ideal love. 3. A belief that they are special and unique and can only be understood by or should associate with other special or high-status people or institutions. 4. A need for excessive admiration. And 5. A sense of entitlement, unreasonable expectations of especially favorable treatment or automatic compliance with their expectations. 6. Being interpersonally exploitative, taking advantage of others to achieve their own ends. 7. A lack of empathy, an unwillingness to recognize or identify with the feelings and needs of others. 8. Being often envious of others, or believing that others are envious of them. And finally, 9. Showing arrogant, haughty behaviors or attitudes. It's important to understand that these aren't just occasional behaviors. They represent a deeply ingrained and inflexible pattern of thinking and behaving that causes significant distress or impairment in various areas of life. Now, here's a crucial distinction. Not all narcissism is pathological. There's a concept of healthy narcissism, which is actually a vital component of a well-adjusted personality. Healthy narcissism involves a realistic sense of self-esteem, the ability to feel pride in one's achievements, and the capacity for self-advocacy, all while maintaining empathy and respect for others. It's what allows us to set goals, pursue ambitions, and protect our boundaries. Pathological narcissism, on the other hand, is entirely different. It's characterized by a fragile, fluctuating self-esteem that relies heavily on external validation. This manifests either as overt grandiosity, an inflated sense of self-importance, or as vulnerable narcissism, where extreme sensitivity to criticism masks deep-seated insecurity. This maladaptive pattern causes significant distress not only to the individual, but more often to those around them. The clinical understanding of NPD is also evolving with advancements in neuroscience. Research has begun to shed light on potential biological underpinnings. For instance, studies have indicated that individuals with NPD may have reduced gray matter volume in the left anterior insula, a brain region associated with emotional empathy. This doesn't excuse behavior, but it helps us understand that there can be a neurological component to the profound empathy deficits observed in NPD. Other research points to markers like increased oxidative stress in the blood and a heightened interpersonal hypersensitivity, meaning that despite their outward arrogance, individuals with NPD can be incredibly sensitive to perceived slights or criticisms. This complex interplay of psychological, developmental, and potentially biological factors paints a picture far more nuanced than the casual use of the term narcissist suggests. Understanding narcissistic personality disorder from a clinical perspective is not about diagnosing others. It's about gaining clarity. For those who have been impacted by it, this knowledge provides validation, helps to dismantle the confusion, and empowers you to recognize that what you experienced was a real, diagnosable pattern of abuse, not a figment of your imagination. This foundational understanding is the bedrock upon which true recovery is built. In our next video, we'll explore how this disorder manifests in relationships, delving into the predictable cycle of narcissistic abuse. Don't forget to like this video, subscribe to the channel, and hit the notification bell so you don't miss it. Your journey to healing starts with knowledge.